is very practical, on-the-ground, concrete steps, addressing causes. What we argued on the Commission on Social Determinants of Health is that we have to address the causes of the causes. So, for example, we know that lack of nourishing food, smoking, dirty water are causes of ill health. But why do people lack nourishing food? Why are they smoking? Why do they have lack of access to clean water? We need to address the causes of the causes, and that means addressing the wider social determinants of health. So we said we've got to address the conditions of daily life, the circumstances in which people are born, grow, live, work, and age, but the structural drivers of those conditions. And right at the back of that has to be a passion, a concern with social justice, because the unfair distribution of power, money, and resources is responsible for the inequities of the conditions of daily life, which in turn cause the health inequities that we see. So I've said that although we come to this as health people, really we have to address the nature of society and the deep unfairness that we see in many societies. I showed, for example, data with which I'm sure Brazilians are familiar, that looking at urban economic inequalities, Brazil is right up at the top among Latin American countries. If really people in Brazil want to do something about health inequalities in a country that's growing and improving health overall, then it's got to address those social and economic inequalities that clearly persist. Well, what it needs, in a way, are two things. One is it needs a social commitment, a commitment to fairness and equity. And that's a commitment from the politicians, but that's got to come from the people. Politicians don't do that unless there's a big drive from the people. So it needs this commitment to fairness and social justice. But the second is we need the evidence. Well, okay, we're committed to fairness, but what should we do? Practically, what should we do? And I gave in my presentation now the example from the review of health inequalities that we did in England, the findings of which I think would apply to Brazil. We had 6 domains of recommendations: good early child development, give every child the best start of life; education and lifelong learning; employment and working conditions; minimum income for healthy living, ensuring people have the minimum necessary for healthy life; healthy and sustainable places to live, work; and taking a social determinants approach to prevention, food, drinking, smoking, etc. So, with a commitment to fairness, equity, social justice on one hand, and practical advice, recommendations about what you could do on the other, I think we can change the world.